name's Dr. Komloshi. I'm a GP at King's North Medical Practice in Ashford. We have been receiving phone calls and letters from concerned patients when they discover a code chronic kidney disease stage 3 on their medical notes. The most important message is that despite its scary sounding terms like chronic and kidney disease, this is considered to be a mild form of kidney impairment. I would invite you to stay with me for the next few minutes so we can go through the details together. Let's start with the basics. The kidneys are a pair of solid organs. They are about fist size and bean shaped, located at the back of the loin on both sides, partially covered by the ribs. They are composed of millions of tiny blood vessel loops that act as filters to remove the waste product from the blood. When we are young, the kidneys work at full capacity and their filtration rate is around 100. We consider this as normal. Over the years, the kidneys might suffer some wear and tear, and the filtration rate is reducing slightly. Luckily, we have so many more of these tiny blood vessel loops than we actually need. It wouldn't affect our well-being or life expectancy if we lose some of this filtration capacity. As you don't feel any different, normally this chronic kidney disease stage 3 is discovered incidentally when the patient has a routine blood test, either for some other symptoms or as monitoring for example, high blood pressure or diabetes. When the filtration rate drops from 100 to about 60 or a little bit below, we code chronic kidney disease stage 3 on the notes. What happened to stage 1 and stage 2? Well, they are completely different diseases. When the filtration rate is normal or nearly normal, but there are other signs of kidney damage like protein leak. This doesn't affect you, so I wouldn't go into detail today. If it's considered to be a mild form of kidney impairment, what's the reason for coding it? It is because it needs monitoring to make sure that levels remain nice and stable over the years. If the levels drop to lower numbers like 30 or 15, the patient might have symptoms or might need kidney dialysis or kidney transplant. We call this end-stage kidney disease. Again, I would like to reassure you that in our day-to-day GP practice, what we experience is that chronic kidney disease stage 3 tends to be a very stable disease and the numbers are hovering around the same level over the years, and it does not tend to progress into end-stage kidney failure. You can consider it as like wearing glasses. If your eyes are not working 100%, you need a little bit of support. Your prescription might get stronger over the years, but it doesn't mean that you are going blind. But it is important to monitor, because we have quite a few things we can do to preserve the filtration rate and kidney function. We need to make sure that your blood pressure is nice and low in the healthy range. We need to have good control over the diabetes if the patient suffers with diabetes. It's important to stop smoking and reduce alcohol consumption if it's above the recommended limit. Maintaining an active lifestyle and a healthy body weight also protect the kidneys. Lowering the cholesterol level also important to protect the vessels. I know that some of these lifestyle goals are not easy to achieve, but the NHS has very good support services, and I leave the self-referral links down below in the description so you can have a little bit of extra help if you need it. Let's say that you are one of the example patients who have achieved all their lifestyle goals and the cholesterol is already very low, the patient is very active, not smoking, not drinking, blood pressure, diabetes under good control. Why is it that the GP is still offering cholesterol-lowering tablet like statin? The statins are not just about cholesterol. They protect the blood vessels from the inside, stabilizing the lining and the plaques. So it protects all the blood vessels in the body. So it gives the biggest protection for those organs who rely on blood supply the most, like our brain, our heart and the kidneys. So even if your cholesterol level is very nice and low through healthy diet and lifestyle, you would still benefit from taking the statins if you have chronic kidney disease stage 3. I know that statins have a mixed media coverage, and you might be reluctant to start taking it because you heard stories of side effects. What would be the worst to happen? You might develop some side effects and your GP might need to switch to a different statin or maybe stop it altogether. But what we see that most patients are absolutely fine on the statins. So it could be a reassuring thing that you do everything what you can do to have a long and healthy life. Why not give it a go? Okay, let's say that you just had your first statin prescription, you take out the patient information from the box and you read it through. You will discover that it suggests not to take it if you have kidney disease. How confusing! You were just prescribed this because you have kidney disease. The leaflet actually is not overly specific. It would talk about severe kidney disease when the filtration rate is below 30, which is not in your case. So you can safely take the full dose as prescribed. This is true to all commonly prescribed medication, including antibiotics, that you can take the full dose without dose adjustments. If you're diabetic and you take metformin, if your levels drop below 45 or so, your diabetic nurse might want to reduce the dose of metformin, but otherwise all other medication should be fine. I would like you to be aware of some over-the-counter medication that are considered normally very safe, but with some kidney impairment, prolonged use could be harmful. This would be ibuprofen and related anti-inflammatories. It's okay to take 1 or 2 ibuprofen for headache or so, but if you need to take it for prolonged time, like 2 weeks or longer, you might want to talk to your doctor about it. The same applies to some stomach acid tablets like Nexium. If you take a couple of tablets for indigestion, it should be fine, but if you take it for a prolonged time, please let your doctor know. If you ever need a CT scan with contrast dye, the radiologist will ask for a fresh kidney function test. So based on the results, they can decide whether it's safe for you to have the scan, but most of the time, with your levels of filtration, it should be fine. I hope that I could reassure you that chronic kidney disease, stage 3, is a mild form of kidney impairment that with good medical care, yearly monitoring and a healthy lifestyle, it wouldn't affect your well-being or life expectancy. Thank you very much for listening.